So we're gonna demonstrate a little bit about the basics of this cupping in terms of decompression with it. It indirectly may affect some muscle, but mostly it is separating and lifting the skin and superficial fascia. And Luke's got a demo right there that we can do it with. You gotta, it works on dry skin or a little bit of lubricant. And then the amount of decompression you get has to do with how much suction you pull. So that's just a little bit. If you can't see it, come around. That's a little bit more. Now, she should be feeling a tug. All right? Now, once I get that off of there, now I got a handle. I can lift that cup up. I can twist it. I can move it. I can have her bend her elbow back and forth, which is going to move the tissue underneath. I can slide it without lotion. Rip. And that's it. The only trick with cupping is that you don't want to put the cup on taut tissue. You want to put the cup on loose tissue so that you can suck it up. All right, so I want this to be, the superficial fascia to be loose. So I want that crowded up. I want the joint to be close together. 1, 2, 3. Now, when she stretches her wrist back and forth, her
and
cup
release.
is parting. So Renee, I'm going to put this on here so that you can feel. Do you use cups at all?
I have tried and failed. I don't have any that have a pump thing. The one I have.
Oh, I don't
that.
like the silicone where you
That's
squish
what I've
them in.
gotten. I don't care.
Okay,
for it.
so I'm going to put your hand right on it. Now, lift it, move it around.
You can pull up on it.
Right there, yeah, just lift right up on it. And see how it drags the tissue back and forth?
Yeah.
Twist it around.
Okay, but you don't go side to side.
You could.
Even if it's dry.
Well, you would want some more lubricant on it.
So I would go.
Yeah.
Well, it's not going far.
No.
There's no lotion.
Okay,
Yeah.
that's cool. I like this.
Now, lymphatic is all about decompression on the superficial tissues. This is a $1,000 class. I want you to know. Turn your arm over so that we're irritating multiple sides. Okay. See it?
Oh, you're moving at different spots.
Yeah.
Mm-hmm.
I'm just coming
Doing
down.
Suction,
Suction.
suction,
Oh.
suction.
Let it go.
Which is very light.
Mm-hmm.
So it follows the same pattern orientation that you would do with your hands-on for lymph. But the idea is that you're just doing these light suctions on that superficial fascia, making space for that lymphatic fluid.
You can, because one of the tenets with lymphatic drain is a little bit of a drag of the tissue up. That's easy to do. As you go to pop it off, just take it up a little bit and then
One version
you
of this
get your
too,
finger underneath.
putting enough lubricant down to do just very light
A
suction
slide.
and then slide
Ah.
and run. This is getting incorporated more in physical therapy, where they'll just generically go over areas with light cupping as just part of their system.
So, and you don't have to leave it on so long that they're going to get the marks. The marks are incidental. So,
But people will learn cupping, and you can see how you could use cupping as a tool for lymphatic drain or as a tool for myofascial release.
so where it's excellent for our torso is in the lumbar area and up in here, because that tissue often gets pressed down and stuck. So it gives you the ability to lift and move it around. And then that is where we can practice the ideas of ease and bind as well. So the last little piece, and then we're gonna have lunch. We'll practice this on yourself, stay put. Okay. Actually, I'm done with you.
Okay.
You better You did really well. Is drag palpation. And what you're looking for with drag palpation is areas that are a little sticky. And the theory behind that is that because the nerve and the blood vessel and the lymphatic vessel that is in the area is activated a little bit. You're getting a little bit of a sweat response. So this is going to be a big sensation. I'll demonstrate it with Renee first. So let me have your hand, Renee. Okay. You use the tips of your fingers, usually together as a unit, and you go fairly fast. And dry. You should feel something different
Right there.
Yeah.
That was cooler.
Some people will feel it as cooler, some people will feel it as sticky, some people will feel it as wet.
Okay.
All right? So if I'm going to use drag palpation on an area, this is what I'm doing. And just doing my, it's best if you don't have lotion on there. So you might as well incorporate a little bit of lymphatic fluidish type of concept because I'm doing it anyway when I'm doing the drag palpation. So, and then I'm looking for that trigger pointy thing is what I'm looking for with that. So if I find it, if I find a spot that's sticky, then I'll press down into it and I'll say, does that recreate your symptom? Now, you got to put enough pressure on it. I mean, if I can get it this way, I will. You got to put enough pressure on it so that you're getting down to the deeper tissues. That's where people will sometimes not, they'll say, well, I didn't get the symptom recreated.